Maggie?
All right, well, thanks so much. And joining us now for today's Medical Matters discussion is Dr. Timothy Quinn with Quinn Healthcare in Ridgeland. And he's here to talk with us today about diet plans for the new year. Thank you so much for being with us.
Hey.
That is a big resolution for so many people, to lose weight or to get healthy. Now, is diet the right word that we should use?
Well, you know, I have a technique or a concept that I introduce to my patients, and it works. Now, I used to be the medical director for the medical program at CMMC, and I flew to the East Coast for a conference on the OptiFast diet. And the concept was you eat every 3 hours, where you're increasing the frequency of your meals, but the quantity is almost the same. And I looked at Weight Watchers, Jenny Craig, all have the same concept, every 3 hours, and it works.
Now, why does that work more so than saying skipping meals, which a lot of us do, especially when you have a very hectic schedule? And a lot of us will skip breakfast or we'll skip lunch and in some cases even dinner.
Right. Well, here's the deal. Your body responds to stimuli or things that occur. For instance, if we turn the lights off, your pupils will dilate. If we turn the lights on, your pupils will constrict. This is your autonomic nervous system. And basically, when you eat, say for instance you eat dinner at 7 o'clock at night, 7 o'clock in the morning you don't eat, that's 12 hours, right? Let's say you eat lunch at noon, that's another 5 hours. So you're looking at 17 hours with no nutrition. Well, that autonomic nervous system is going to kick in, and the first thing that's going to happen is your metabolism is going to slow down. It's trying to hold on to calories. The second thing is you're going to store more fat because you're trying to store calories. And then when you do eat, you're so hungry, you're going to overeat. It always happens. So what I suggest is every 3 hours, consume some food, about 300 calories, and I'm telling you, it works.
Now, when you say consume some kind of food, what are the best things? Because a lot of us will go to that vending machine and grab something, which, again, defeats the purpose of what you're talking about.
Right. Well, here's the deal. You want to be prepared. What I normally do is I prepare my food the night before. Like, for instance, I might make a sandwich and cut it in half and eat half during one break and half during another break. But you want to eat throughout the day. Another example, if I go to a restaurant, I'll tell the waitress to bring half of my food on a plate and leave the other half in the kitchen in a to-go plate. And she'll say, well, why not just bring you a to-go plate at the end? You know, if they don't know me. but the deal is, if she brings all the food, I'm going to eat it.
Right.
So you want to limit the amount of food that you have exposure to. And as far as what to eat, we really know when we're not eating healthy. You know, just ask yourself, is it healthy? And in most situations, we know what's healthy or not. But the most important thing is just remember, don't skip meals. Feed yourself throughout the day and try to have something between breakfast and lunch and something between lunch and dinner, and your body will go into that increased metabolism status where you're burning calories more quickly, you store less fat, and you know that cuts down on diabetes, high blood pressure, and heart disease. And when you do eat, you're not starving, so chances are you'll eat, you know, more.
A healthy portion.
Exactly.
Now, one of the things that as a woman, I know when we gain weight, we usually gain it in the abdominal area, and that's one of the worst places for us to have it because we understand the risk as far as heart disease.
Right.
And then it affects everything from your breathing to even when you try to exercise, it's more limiting.
Well, I mean, the research has shown that abdominal obesity, which is the storage form, when you're eating, you know, skipping meals, that causes a higher prevalence of diabetes, heart disease, and so on. So it's not all about just looking good, because you know, a lot of people think that diet is all about vanity, but it's about being, you know, more healthy. And, you know, not having to have high blood pressure and diabetes, because in a lot of cases, these conditions, which are multifactorial, meaning that your genetics do play a part, but a lot of it deals with your lifestyle, such as your diet. So if you can eat in the manner that I'm speaking, I mean, you could significantly cut down the chances that you will develop, you know, these conditions such as diabetes and heart disease. And if you do develop these conditions, it'll be at a much less extent. Say, for instance, somebody that has diabetes and they take insulin and pills and it's poorly controlled, if they can, you know, eat in a more healthy manner, such as, you know, what we're talking about today, they may be able to get off the insulin. They may still have diabetes, and maybe they'll only take the, you know, the oral tablet.
Right.
So, you know, they'll have a better diabetic control and, you know, less kidney disease and all the other things that go along with uncontrolled diabetes. So it works, you know, and at the end of the day, we just want to be healthy.
Exactly. Now, what about nuts? I know we hear a lot about almonds, not the salted almonds, but just almonds as well as walnuts and things of that nature. But you also have to be very careful because some of them have a lot of oil.
A lot of
and
oil.
So, yes, and they could make a difference in, again, that weight loss. Because we get discouraged when we think we're doing all the right things and we still don't see a change in our bodies.
But I still stick to the golden rule. Ask yourself, is it healthy? I mean, you're driving down the street, you see Popeye's chicken, you see Subway. You just got to make the right decision. And we know what's healthy because, like, you know, at my place of employment, my job, they always have some donuts on the table back there. And I'll go back and I'll look at them. I might smell them, but it's hard, you know. But the deal is you just have to make those choices. But if you eat in the manner that I'm speaking, there's a better chance that you won't have that donut because you're not starving.
Well, I've learned, I always tell myself, if I put it on my lips, it goes to my hips.
Right.
So that makes me think about it a little bit.
Motivation.
Exactly. Dr. Quinn, thank you so much for being with us today. And again, I hope everybody has listened and will get off on the right foot for the new year.
There you go.
Thanks again so much.
Thank you.
Well, talks have broken down in a deal to improve mental health care for Mississippi.